I'm Doug Abel, Vice President for Public Affairs and Communications for Harris County Medical Society. Welcome to our third episode of our Artificial Intelligence in Medicine podcast series. Once again, I am joined by Dr. Eddie Patton, a Houston neurologist who has been in practice for about 14 years and who has been applying various forms of artificial intelligence in his practice. Today, we want to focus specifically on a piece of legislation that is likely to come up in the next legislative session that is going to seek to regulate artificial intelligence. Obviously, artificial intelligence is moving very quickly, and it needs to be regulated. There is a bill that we're working on with some elected officials in Austin. They will do just that, but it is a multi-industry bill. It is not specific for healthcare. So we've already talked about the fact that health plans are utilizing artificial intelligence in ways which may or may not be positive for patient care. So what I'd like for you to do is to focus, if you would, on what aspects of healthcare that concern you with regard to the use of AI and where you think regulations should be aimed to be able to handle that. Dr. Patton, once again, thanks so much for your time. And we're very much interested in hearing your thoughts on this topic.
Thanks for having me. It's always good to come here and talk AI with you. Yeah, first of all, Doug, I have to say, I think our legislators in this upcoming session are going to have a tall task with trying to put some regulation behind AI and its use, because we're seeing it in so many different fashions, and technology often and frequently outpaces regulation. So it's going to be hard. And you mentioned that this was a multifaceted bill, piece of legislation, a lot of different industries. But when you look at healthcare specifically, I worry about a couple of things. One of them being, first of all, transparency. How transparent do we as clinicians have to be with our patients with what's being used? When we use ambient AI for things like recording the visit, do we need to let our patients know? What type of disclosure do we let them know that, hey, this visit is being recorded and an artificial intelligence program is going to take the visit data and transcribe it into my note, which is going to go into your EHR. Is that important for the patient to know? Or will the claims be based on this? And if the claims are adjusted or not based on the EHR, how much does the patient need to know? The transparency issue is going to be one big thing that, particularly in healthcare, with protecting electronic health records, we really have to take into account. It's very sensitive information that we're talking about, and we're depending on these artificial intelligence programs, which are algorithms that learn from each other. As clinicians, we try to be very sensitive to the information that we get put in, and the information learns from each other. So how do we keep that information sensitive and secure, but we want to put as much of it out there so that the system can learn from itself and continue to perfect itself? So how the legislators are going to try to regulate that is going to be very important for this bill moving forward. And the other thing is that these developers are much smarter than me. And I spend a lot of time in classrooms, but they're constantly creating these algorithms, which is the base for how these programs learn. So how do we regulate that? How do we make sure that the algorithms are non-discriminatory versus whether it be different races, ethnicities, or whatever? So that mitigation or that regulatory burden on trying to regulate, make sure that none of these algorithms discriminate is going to be a really important part moving forward as well.
So that brings up a really interesting point. You talk about how the algorithms learn from each other. Healthcare had a somewhat similar experience 10, 15 years ago with the introduction of the technology now known as electronic health records. And it was a similar situation in the sense that it was a very rapidly moving technology. It was technology that was out in front of physicians. So what lessons do you think we learned from that experience that are applicable to now to dealing with artificial intelligence? And how do you think that healthcare and those of us who represent and advocate for physicians, can better position ourselves in the legislature to introduce this in such a way that it's not disruptive to the physician's workflow and to healthcare while it gets introduced into the way that everybody seems to work.
Well, I hope and pray that we learned a lot from that experience because when this was passed and introduced and what it was intended to do, I don't think as a House of Medicine that we had enough input into the design and implementation. And by that, I mean that the product we have now is more heavily favored toward what the insurers need than what the actual physicians and the patients need. So with artificial intelligence and the applications moving forward, it's important that we're at the table, that we're talking to the legislators and letting them know what's important to us and what's important to our patients, so that hopefully we can avoid a situation like what happened with EHR, where it can be regulated that, hey, you've got to do this. In theory, it's going to help. But once the actual product comes out, you realize it's a lot of unnecessary things and things that don't really help you as a clinician. Now, it may have helped from the standpoint of the regulatory, as far as the claims and claim denials and those type of things. Again, more so for other parts of the healthcare industry. And again, we are physicians. We're worried about treating patients, figuring out the treatment. So we're not, for the most part, designing these systems. But it's important at this stage, in the early infancy stages of this, that we get involved legislatively to help regulate this. And from a design standpoint, let's try to get involved and say, hey, what's important to us? What don't we need? What makes our life harder? If these tools are really in place to make our life easier and to decrease the interference between the patient and physician relationship, then we need to be a part of the process and how that's designed out. And another point that I want to emphasize with this and how it should be regulated is that there's no replacement for a physician. Doctors have spent years in training, and there's so much that we've learned from just patient interaction and with our patients. So I don't think there's anything that can replace that aspect of medicine. But artificial intelligence, these tools should be created to augment or help a physician to do that. If we keep that in mind, and if legislators keep that in mind, then we should be able to help design products that really help physicians to remain autonomous and decrease the interference between the patient-physician relationship. And we should be able to regulate this industry in a way where it protects patients' information and protects the sanctity of medicine.
Very great points. Thank you so much, Dr. Patton. We really appreciate your time. That's all that we have time for this episode. We hope this has helped you to become more interested in artificial intelligence and how it might be applicable to your particular practice. Go out and educate yourself on these, but always keep in mind this is not a substitute for any physician, any clinician. Always check on the accuracy of the information that you get. Until next time, thank you so much for watching.